Hi, this is Dr. Beverly Goode-Kanawati, and we got a request from you, one of you, regarding a topic. So she wrote, I have MCS, meaning multiple chemical sensitivity syndrome, due to mold exposure. Do you have a video on that? So I thought, what a great idea. I'll make a video on that. So mold exposure and mold sensitivity and chemical sensitivity are often wrapped up together, because what it is your immune system being hyperreactive to chemicals and substances around you. So most people who have multiple chemical sensitivity and mold sensitivity also have sensitivity to foods and other items, other things in the environment. And so they kind of all wrap up together. I myself had pretty bad multiple chemical sensitivity. So there are three things that have to be done for you to improve from multiple chemical sensitivity. One is avoidance. So if you've got mold, you've got to get it out of your environment. So if it's on the wall, you need to replace part of the wall because the mycotoxins don't go away. You can kill the mold, but you can't kill mycotoxins. They're just toxic chemicals that sit around. So you have to actually replace sheetrock if it's in a wall. If it's in the tile, you probably need to pull up that tile and put new tile. But in any case, with mold and with multiple chemical sensitivity, avoidance is key. So you've got to avoid the chemicals for at least a period of time. So if you can do a really good avoidance for a good 3 to 6 months, along with whatever foods you're intolerant to, because that always goes together, then you have a chance of down-regulating your immune system in order for your system to become less and less reactive over time. And it does take time. It can take months, it can take years, depending on how reactive your system is. So we have avoidance first, and then you need to protect your system from the toxins that you have internally and that you're continuing to be exposed to until you're able to eliminate as much as you can from your environment. So that protection includes lots of antioxidants. And you'll hear a similar theme from me, but vitamin C is very important. Vitamin E is important. Other antioxidants are important, things that help your body make glutathione. So it's really important for you to do a lot of work with protection in terms of getting your system saturated with antioxidants, in particular vitamin C is a critical one. And then the last thing that you need to do to really get better from this is to detoxify. So what do I mean by detoxify? That means helping your body to get rid of the chemicals the best way that you can. So sometimes that means taking nutrients that support your liver. So what supports your liver? For some people, it's amino acids like cysteine or even methionine or glycine, etc. Because there's multiple pathways in the liver that often need assistance because they get overwhelmed by all of these chemicals and toxins. So sometimes taking a group of nutrients to help your liver detoxify is extremely helpful, along with those antioxidants I talked about previously. Other ways of detoxing are through sweating. So we have like a protocol for a sauna protocol where you take a form of niacin, like a no-flush niacin, along with minerals, vitamin C, NAC, and when you sweat, you lose toxic chemicals through your sweat. Now you also lose minerals, so you have to take minerals and vitamin C while you're doing it, and then keep wiping off the sweat, and then ultimately when you're done with that process, take a shower with a fatty soap in order to get off anything that's lingering on your skin. So you just keep wiping off the sweat and then you take that shower. And that's another way that can help. We also use salt and soda baths. We use Epsom salts and baking soda. But those things have to be prescribed, and also the saunas, etc., need to be prescribed by your doctor, because your system may not be healthy enough to be able to withstand that type of heat and that kind of detox. So you have to do those under the guidance of your doctor or healthcare practitioner. That's really important. Like if you have heart disease, you don't want to do a sauna. You don't want to get real hot. So there's certain things you have to be careful with. But in general, that's the overall way that we help with patients detoxifying. So over time, as you avoid things you're allergic to, as you saturate your system with antioxidants to help protect your tissues and heal your tissues, so vitamin C and quercetin are two things that we use for that, and then you detoxify, eventually your immune system downregulates so you become less and less reactive over time. So hope that explains it. Thank you for watching. If you have any topics you would like to cover, please comment below or email us. If you have any questions about this video, please do the same. Thank you.